Hello friends, welcome to Dr.Bone YouTube channel. Today we are going to talk about a very interesting topic, that is growth hormone. So what is this growth hormone and how is this helpful to us? So in our regular practice, many parents they keep asking us like what is this growth hormone and how can we increase the height of my child. So I think this should be helpful for many such patients or patients' children. So, how can we increase this growth hormone naturally, or what are all the factors which are going to increase the growth hormone in our human body? So, first we will see if there is any deficiency in the growth hormone, how that is going to affect on children. So, in children, we are going to see a condition which is called as dwarfism, and if the growth hormone levels are very high, then it is going to lead a condition which is called as gigantism. So, and now we are not going to touch any other deficiency or like overproduction of growth hormone. That is completely a different topic. Now we are going to see only about growth hormone and the factors which are going to stimulate the growth hormone. So first of all, what is the first factor? So the first factor is the fasting, that is intermittent fasting, or any any decreased glucose levels in the blood. This is going to stimulate the growth factor. So because this is a very common thing which we do in our Indian society. Now, like whenever we have a festival like Shivaratri, we don't eat or we do intermittent fasting. That also helps to increase our growth hormone. And the second factor is ghrelin. This is one hormone which is secreted by our stomach, that is in the fundus part of the stomach, and a small portion is also secreted by pancreas. This also helps to stimulate the growth factor. And third one, regular exercise. So this is another important factor. So this is the reason why doctors, we also recommend schools to encourage the sports activities in the school or do some regular exercise for children. That is because this is going to help their height or increase the growth hormone. And so the next question might be is like, sir, what are all the exercises which we can do and how that is helpful? So the main regular exercise which you can do is like stretching exercises, and you can also play basketball, swimming, and sprinting. Like you can do some fast walk. Okay, that also helps you. And in trauma, so whenever you met with some accident or any history of fall and these traumatic conditions, that also helps in increasing the growth factor, but it doesn't mean that you should get traumatized. And we have another next factor which is stress. During in a stressful condition, okay, in such conditions also you will have increased levels of growth hormone in our body. And the next one is whenever we have blood amino acids like arginine and GABA, and these two also promote or stimulate the growth hormone. Okay, and we have sleep. So during sleep also our growth hormone stimulation is higher. That is especially in non-rapid eye movement phase 3 and phase 4. So during these phases we have increased amount of growth hormone production in our body. So that is why it is good. Good sleep can help to increase the growth hormone in our body, and that affects the height of the children. And our male sex hormone, that is testosterone, and female sex hormone, that is estrogen, these also stimulate growth hormone. So when we have all these factors are going to stimulate the growth hormone. So you might ask, sir, is this growth hormone only related to children? No. This growth hormone is also helpful in elders in maintaining their muscles or to decrease their fat content in their body. So now we will see how this growth hormone has its effect on our bones. First, this growth hormone gets converted into insulin like growth factor 1 in our liver, and then this insulin like growth factor 1 acts on our bones, that is especially on our growth plate, and it will increase the height of our growth plate, and which in turn increases the height of children. And this is how it works. So, and the another regular question which many children ask us is, first thing, sir, how about our height when our growth plates are closed? Then that we cannot promise in each and everybody. So, in few children, whenever you have all these stimulating factors, it might increase in few children, and it might not work in other children, that we cannot do anything for that. And so when does this growth plate closes? So suppose if there are males, that gets closed around some around 19 to 20 years, and in females this growth plate closes at around age of 17 to 18 years old. So that's it about growth hormone. I hope that should be helpful to everyone. Thank you.
Perfect.